Hi, this is Jessica DeMassa, and I'm here at the GuideWell Insights Lounge here at Singularity University's Exponential Medicine in 2017. And I am joined by Dr. Sonia Ramamoorthy. Did I say it correctly?
You said it correct.
Oh, good. We practiced. And she is the Chief of Colorectal Surgery at UC San Diego Health System. Welcome. It's good to meet you.
It's great to be here.
So I had an interesting conversation earlier today with one of your patients. And Larry Smart, and we spoke about an experience that he had. So for everybody who didn't see our earlier interview, can you give me kind of an overview of Larry's case in particular, because that's the panel that you were participating in earlier.
Okay. So Larry is a gentleman who's had long-standing inflammatory bowel disease, and he's sort of started to fail medical therapy. The medicines weren't working as well anymore. And he went ahead, and Larry has a lot of resources, being a scientist and a founder of CalIT, which is part of our engineering department, to get a lot of imaging and different things done. So he sort of self-diagnosed himself as progressively developing an obstruction of his colon, and gone to his GI doc, had said, I'm having these symptoms, now I have this imaging and all of this information on my stool and labs. I think I need to see a surgeon, and so he was referred to me.
Yes, and so for those of you who didn't see the other interview with Larry, definitely check it out, because he talks about doing his own microbiome testing and reading through all of the profiles there. He talks about his diagnosis. He talks about getting all of the myriad scans that he got done, and then also building from those scans a digital 3D image, which he then 3D printed into the piece of colon that needed to be taken out.
Right.
So as his surgeon, dealing with a highly empowered patient, I actually asked him, like, so how was the doctor who was working with you with all of this? Because you seem very prepared. So, you know, from your perspective.
Well, so it's funny. I think most people think, well, if you walk into your doctor's office with all this information,
and a 3D printed piece of your colon,
right, doctor's going to be like, oh my God, here we go. But it's great to have an empowered patient. Great to have someone who cares about themselves, is proactive, has read up and knows what's going on. You can really have a good conversation, and they're very insightful about what's going on in their body. So I've never had a patient walk in with a PowerPoint presentation and a 3D model of their colon, but there's always a first. And so really I was captured by Larry's knowledge of his disease, what was going on, and really all the different pieces of information he was bringing to me. It was going to make surgery that much better for him, with a better outcome for me to understand everything that he understood about himself.
Now, speaking of outcomes, do you feel like the outcomes from his surgery were better as a result of the fact that he was so highly participatory in it?
I think, you know, Larry bringing all the information that he brought to the table was huge. I mean, it was truly a partnership in his wellness.
Yeah.
And so he brought in the information about his symptoms, like most patients, but then he brought in all this other data about his inflammatory state and how long it had been going for. The records were incredible. But just the 3D imaging, which we have always wanted in colorectal surgery, but it's been harder to get for this part of the body. It's a little more challenging to get this kind of imaging. And he was able to bring it to me, and I realized what a difference it made for me in terms of my thinking and planning his surgery. I would love to offer that to every patient I had.
That's fantastic. Yeah. I want to ask too, you know, from the clinician's perspective, from the surgeon's perspective, you know, what is your advice for I guess, to pass along to the future here to other surgeons about working with a patient who is so informed? Because I mean, we're here and we're talking to people, and you know, you can pay $400 and get your microbiome done. I can do that. You can do that. And I guess, you know, people are saying that the democratization of healthcare is the goal. But as the doctor, how do you deal with us once we think we know what we're doing?
Well, I think, you know, part of what patients are trying to do is help themselves. Like, you know, I mean, they're scared and they want information. They want to make sure you know everything you need to know about them to have the best outcome again, and to limit complications and improve safety in the OR, all that. And so you have to sort of understand where they're coming from, and then really start to triage what's important information from what's not going to be relevant, and then help them understand it with their knowledge base. You know, they're not up at medical school level, but they're not uneducated either, and they know more about themselves than you or anybody else. And so now we've got to put all that together and come up with a plan that they understand and will participate in, because that's kind of going to be the best outcome in the future.
Fantastic. And I want to say one last thing. I want to ask one last thing about what you had mentioned about having 3D imaging available in the operating room. Talk a little bit more about that, because I mean, we're hearing about all these different advances here, and so from your perspective, from the surgeon's perspective, what's the opportunity there?
Well, I mean, it's like the dream. What's the dream? The dream is to have the 3D image of your patient's disease process, be it the heart, the colon, the kidney, and to be able to look at it before you're in the operating room and really understand all the things you need to understand. Where are the blood vessels that you're going to encounter? Where are the trouble zones? Where are the no-fly zones? If you're in the brain, where do you want to stay away from? Because it could have potential disability in the future. And to sort of be able to integrate all of that kind of stuff before you get there, so you know what you're doing and you have a map, just like a Google map of all the things you want to do before you get there. So again, you're trying to limit the collateral injury that could happen with surgery.
Fantastic. Well, we look forward to a future of more empowered patients like Larry, and thank you so much for joining us to contribute your perspective to his story.
Terrific.
Thank you. I'm Jessica DeMassa here at the GuideWell Insights Lounge at Singularity University's Exponential Medicine 2017. Thank you so much for joining us.